Hi, I'm Dr. Brandon Elnekaveh, and today we're going to be talking about eyelid surgery, or blepharoplasty, and brow lifts. So in eyelid surgery, we have upper eyelids and lower eyelids. For the upper eyelids, we're generally just taking care of that extra skin that causes hooding and blocks the eyelid margin. For the lower eyelids, we're dealing with the fat prolapse, or excess fat that can protrude beyond the skin here, and then also dealing with the wrinkles underneath the eyes and the extra skin that's on the bottom there. Sometimes the lower lids are really lax, is elastic, tends to fall down, and we have to do what's called a canthopexy. We stick the lower eyelids back onto where it's supposed to be, tightening them up and making sure that they don't fall down after surgery. In addition to the upper eyelids, sometimes the brows tend to sit a little bit too low with aging. For men, they're supposed to sit right at the orbital rim, whereas for women, there should be a little bit higher and peak about 2/3 laterally. So in order to do that, we can either hide the incision for guys in a wrinkle in the forehead, but more often for women, we're doing it in the temporal region in the hairline, and that lifts up the brows and puts them in a nice position. A lot of patients ask about incision placement. For the upper eyelids, it's just in a lid crease that's always nicely well hidden. For the brow lift, it could be in a crease here, or more commonly in the temporal region where there's hair-bearing area, be covered by your hair. For the lower eyelids, there's two ways of doing it. The first way is going through the eyelid so you don't actually have a scar. And the second way is to have a subciliary incision or incision right underneath the lashes. And that's very well hidden and it lets me take out a little bit of extra skin. Sometimes we can do two approaches, through the eyelid to get out the fat and then a little bit of skin pinch to remove that skin underneath the eyelash. At the same time, I can do that canthopexy through the same incision. So there's no extra incisions for that one. When it comes to anesthesia, we can either use general anesthesia or local anesthesia. General anesthesia, patients are completely asleep, and we're able to do a little bit more. So I could do your upper eyelids, your brows, and as well as the lower eyelids as well. As for local anesthesia, we generally give patients some medications by mouth to help relax them. Then we inject with local anesthesia to completely numb them. And then we're able to do the brows and the upper eyelids. We're also able to do a canthopexy and kind of hold the lower eyelid back. Post-operatively, patients can expect to have some swelling and bruising. That's very normal. There could be some numbness in some areas. This generally clears up in about 2 weeks. For the first few days, it might actually worsen, and then it'll get better and better as the days go on. Generally, patients need to be using a lot of ice constantly. So we have patients 10 minutes on, 10 minutes off of ice, making sure that the head of the bed is elevated for about 5 to 7 days. Tylenol, Advil is generally okay, but I'll give some narcotics just in case, and an antibiotic. Lastly, I like to have patients use antibiotic ointment. This is applied at night because sometimes the eye doesn't fully close with all the swelling, and it allows the eyes to have some good lubrication and protects the cornea while you're asleep. If you're interested in eyelid surgery or brow lift surgery, please call us South Florida Center. We also offer free virtual consultations, so I look forward to meeting you soon.